Good day, dear colleagues. My name is Peredelskaya and I'm an allergologist, and last 15 years I help for people with allergic disease to increase his quality of life. And now I want to say to you about bronchial asthma and relationship with smoking of that disease. As you know, now everybody knows that smoking can kill. And this is especially important for asthma patients. But the history of asthma treatment has been strongly associated with smoking. For example, Marcel Proust had been bronchial asthma and used stramonium cigarette to treat his symptoms. But he was not alone. In the 19th and early of 20th centuries, smoking tobacco, smoking stramonium and labelle was very popular to treat asthma. But it's known that morbidity and mortality for asthma is higher in cigarette. We know now. Smokers is higher in cigarette smokers compared to never smokers. Asthmatic smokers have more severe asthmatic symptoms, greater need for rescue medication, and poor health outcomes compared to never smoke. Smokers with asthma may be resistant to benefits of the therapeutic effects of corticosteroids. Cigarette smoking and asthma together accelerate the decline of lung function more than either factor alone. Cigarette smoking increases the clearance of drugs by induced of few metabolizing enzymes, so patient required large doses of drugs. And the next problem is the smoking can trigger the development of asthma. The dangers of smoking for pregnant women, prenatal and postnatal exposed to maternal smoking causing wheezing and asthma of the offspring, especially in the first years of life. But it's not just active smoking that can be trigger asthma symptoms. Secondhand smoke is linked to asthma in children. And we have a big problem with smoking in houses and cars. And the children is under influence of the tobacco smoke. It's important to limit the access of and appeal of any nicotine contains product to minors. We know that quieting tobacco smoking has positive benefits for people with asthma, and our goal to motivate people with asthma to avoid smoking. For patients who are not motivated to quit smoking, the concept of harm reduction is currently being considered. Reducing risk by switching to smoke-free products significantly prevent potential to reduce harm to health, risk reduced by up to 95%, such as electronic heated tobacco system. In the SCOHRE library, we can see systematic review of the use of the electronic smoking cessation devices, and they are used alongside nicotine replacement therapy. Some medical associated have interrelate the position that harm reduction strategy may be available for patients who smoke but are currently unable to quit. And now that we are living in the new period of smoking, new smoking devices appear in our life. And our science interest is understanding of effects nodes devices on the asthma patients. The key goal of my research project studying the influence of electronic tobacco smoking devices on the course of bronchial asthma, clinical, functional, and inflammatory aspects. Is to study the functional and clinical changes that occur in patients suffering from the bronchial asthma against the background of the use of the electronic means of health tobacco and electronic means of tobacco delivery nicotine and classic cigarette. Our material and methods This study will include 100 patients using the various of type of smoking devices. As the main group include non-smoking patients, the control group. In the main group, it's smoking people, and the control group is non-smoking. All patients had previously been diagnosed with bronchial asthma, a clinical and functional assessment in the patient's condition, the level of control and the quality of life, as well as assessment of the biological markers of inflammation will be carried out. The aim of the study was to evaluate changes in the inflammation profile depending on our means used to the tobacco and nicotine use. And we have some results. We just to start our research, we just to start take the patient, and currently the study includes only 34 patients with bronchial asthma, 33 men and 1 woman aged from the 18 to 20 years. On these 13 are non-smokers. The rest use various type of smokers device. It's noteworthy that 10 of them 47% are double or triple users of smoking drugs. That is, they use both classic cigarettes and electronic nicotine delivery system or nicotine tobacco heating device. The assessment of asthma control according to the AST test questionnaire in the control group non-smokers was 17.15, and in the group smokers 16.4. The AQLQ, it is a questionnaire about quality of life. Score was 4.25 in the control group and 4.6 in the study group. And in conclusion, I want to say that results are preliminary and required further study. And thank you for your attention, and let's get free for your lungs and the lungs of our world. Thank you.